Beta blockers or beta adrenergic blockers, also known as the OLOL. So they end in OLOL. So from the class name itself, beta adrenergic meaning it's working on adrenaline, epinephrine, norepinephrine. And when we say blocker, it means they're an antagonist, so it blocks its effect. How do beta blockers work? So mechanism of action of beta blockers. Before we can fully understand it, we have to also understand the receptors. We have beta 1 and beta 2. Beta 1, it's primarily located on the surface of the heart. So one thing to remember, beta 1, we have one heart. Now beta 2 is primarily on the smooth muscles of the bronchioles and blood vessels found in the arterioles of skeletal muscles. So beta 2, there's two lungs. Again, beta 1 refers to cardiac, beta 2 lungs. So how does that work? Beta blockers bind to and block the beta 1 and beta 2 receptors. Now we have cardioselective beta blockers. Cardioselective beta blockers bind to and block the beta 1 receptor in the heart, right? Because it's beta 1. And so it binds to the beta 1 receptor and it affects the electrical conduction system. Therefore, it will decrease the heart rate because it will block it. It will inhibit that effect. You can also have non-selective beta blockers. What happens there is that they bind to and block beta 1 and beta 2. Non-selective, they don't really choose. So either or both, right? So it will bind to those receptors which can be located in the heart, lungs, or somewhere else within the system. So when it comes to these medications, we have to use them cautiously in patients who have pulmonary disease or illnesses. Why? Because it can affect the lungs because of the beta 2 receptors. And what can happen is that when it prevents vasoconstriction in the lungs, it may cause vasodilation. And the vasodilation can cause the bronchioles to constrict because of that extra fluid or extra pressure in those vessels. Alright, so as you can see here, again, beta blockers, how do they work? The yellow is the receptor site for norepi and epinephrine. How the beta blockers work is that it blocks those receptors, so now norepi and epinephrine cannot bind to this site. And so usually the effect of norepi and epinephrine is to constrict. Now, if they're unable to bind to the receptor site, then it will cause the opposite effect, which is the decrease in blood pressure and vasodilation. In addition, it decreases renin secretion. Therapeutic effects of beta blockers include decrease in blood pressure because of decrease in constriction, decrease in resistance, therefore decrease in afterload. As mentioned earlier, it can affect the heart rate. So what it does is it decreases the heart rate because of the decrease of SA node firing, and this is considered a negative chronotrope. In addition, it decreases myocardial contractility, which in turn decreases the O2 or oxygen requirements of the myocardial cells. So because of that, it decreases the myocardial oxygen demand. These medications are considered negative inotropes. It means that it weakens the force of muscular contraction of the heart. Chronotrope pertains to heart rate. So when you hear negative chronotrope, it means that it makes the heart rate go down. If you hear a positive chronotrope, it means that the heart rate goes up. Inotrope, on the other hand, pertains to myocardial contractility or force of contraction. Negative inotrope means that it decreases myocardial contractility or the force of contraction, while positive inotrope means that it increases myocardial contractility. Indications or reasons why some patients need beta blockers. 1. Hypertension. 2. Angina or chest pain, because it decreases the oxygen demand of the myocardium, and in addition, it's also used for MI or myocardial infarction. This is also used for dysrhythmias because of its effect on heart rate, because it has the ability to slow down rapid heart rates or rapid dysrhythmias. It is also used for heart failure, more specifically left ventricular systolic dysfunction. Some precautions. Patients who are taking beta blockers should be very careful when they're taking other medications that will affect their blood pressure because, again, it can increase the risk for hypotension. It is also very important to be very careful when administering this medication to patients with pulmonary diseases or illnesses when it comes to administering non-selective beta blockers, because it causes bronchial smooth muscle contraction and it narrows the airways. This may lead to shortness of breath. We have to be very careful when it comes to administering this to patients with heart failure and some cardiac dysrhythmias. Example would be bradycardia, because this medication is known to slow down the heart rate. If somebody is already bradycardic, then it will just make it worse. We have to be very cautious when administering this to patients with diabetes who are on diabetic medications, because it can mask the evidence of hypoglycemia or low serum glucose. So beta blockers block glycogenolysis, the production of glucose from glycogen, which also can delay the recovery from the hypoglycemic episode. And in addition, as mentioned earlier, it masks or blunts the perception of symptoms associated with hypoglycemia, which includes tachycardia, tremor, or nervousness. So without those symptoms, a person may not even know that they're having a hypoglycemic episode. That being said, beta blockers can also affect insulin secretion. Therefore, it can also cause hyperglycemia. So again, it can mask the symptoms of hypoglycemia, but it can also make the blood sugar go up. Some contraindications, some pulmonary disease, and some cardiac dysrhythmias. Side effects or adverse effects, CHF, so some cardiac dysrhythmias such as bradycardia, bronchospasm or bronchoconstriction, which can cause dyspnea or wheezing when it comes to non-selective beta blockers, and it can cause fatigue, depression, and impotence. Some nursing actions. So assessment. It is very important to assess the patient's blood pressure and heart rate before and after giving this medication. Also, we need to assess for their pulmonary status, right? Because of the non-selective beta blocker effects. INOs, daily weight, side effects. It is also important to do a focus assessment on the cardiac and pulmonary systems of the patient. And when it comes to patient education, as always, we want to educate them regarding the drug, including the side effects, how to monitor their heart rate and blood pressure at home, the effects of the medication if they're taking similar drugs, possible hypotension and the signs of symptoms of hypotension, and again, talk to them about their renal functions and the symptoms related to serum blood glucose, especially when it comes to diabetics or patients taking medications that can cause hypoglycemia, or even just patients without diabetes that have a tendency to run low. So it is also very important to emphasize compliance and ensure that the medication is tapered slowly to avoid adverse reactions from rapid withdrawal of the medication. So this medication, not because they're feeling better, they can't just stop it immediately without slowly tapering off, because then it can cause rebound hypertension, or even worse, it can cause some other worse adverse effects from just abruptly stopping the medication. Examples of drugs in this class include the following: Inderal or propranolol, Lopressor or metoprolol, Tenormin or atenolol. Non-selective beta blocker is propranolol or Inderal. Selective includes metoprolol and atenolol. So again, non-selective is propranolol and selective is metoprolol and atenolol.